Good afternoon, class. Today we're going to learn intradermal injections, IDs. You've already learned sub-Q injections and IM injections, intramuscular and subcutaneous. The subcutaneous injections are, you're going to use a 23 to 25 gauge needle, and those are going to be at 45 degrees. Your intramusculars were the 90-degree angle, and then 20 to 23 gauge needles. So for the IDs, we're going to use a 15-degree angle, so it's a bit different. I've got a slide I'm going to show you. You're going to have a 15-degree angle on an intradermal. So as you can tell, it's almost laying on the skin, and we're going to actually show the wheel there. You will have a wheel pop up if you do an ID correctly. We'll do one at the end of the class. I'm going to go over all the directions with you so that you have it down pat and you're comfortable with doing an ID before we get there though. Also, I wanted to let you know that TB tests are used with IDs, and also allergy tests are one of the other things that they do with a TB test now. So a TB test is used with this, and allergy test. TB tests are done with doctor's offices almost every 2 years because they're exposed to different factors that, you never know when somebody's going to come in that might have TB that you might have been exposed to. So most nurses or certified medical assistants are tested for tuberculosis every 2 years. They usually come back negative, but they are tested. So your wheel is checked at 48 hours, sometimes 72 hours. And depending on what your result is, you may have to have further testing, possibly a chest x-ray. So it just depends on what your result is. We're going to go ahead and go through another slide here. Let me show you this one. This talks more about an intradermal injection. Talks about where you're going to give it. You're going to use it in the lower aspect of the forearm. You're going to use a 25 to 27 gauge needle that we talked about. You're going to use a 15-degree angle. You're going to use the upper layer of the skin, and then the injection should not cause bleeding. It should just cause a little wheal. And I'm going to go ahead and go over the directions with you on this. It's a lot of directions, so don't feel like you're pressured on this. You'll have your books when we go over this, so you can go have your books out during class when we cover all this. First, you're going to sanitize your hands. Something we always do anytime we're with a patient. We want to sanitize our hands. You're going to collect your medication. The TB is always kept in the refrigerator, so you're going to pull that out of the fridge. Make sure you have the correct medication. You're going to read the label. Make sure it's the PPD. You're going to confirm the medication matches what the physician has ordered. Like I said, you're going to check that. Warm it between your hands. Just, roll it between your hands a few times to warm that up. You're going to prepare your syringe like you would with any other medication. You're going to draw up 0.1 mLs is how much we use for an ID with a PPD test. That's what we're going to be doing today. We're not going to do any allergy testing. I do have some allergy samples that I'm going to show you today, though we did some allergy testing at another class, and so we're going to show you those samples. You transfer the medication to the patient, greet the patient, and check their name. You want to ask the patient if they've ever had a positive TB test. If they say yes, they've had a positive TB test, you want to go check with the physician, because he may change what he's ordering, or he may still say yes, go ahead with the TB test. The purpose for that is just to make sure that their antibody reaction is going to react correctly. You're going to locate the correct position. I'll show you where you're going. It's going to be right in here where you're going to give your TB test. It's usually the same place on everybody. Just wrist up, a couple of fingers right there. You're going to pull the skin taut with your thumb and your fingers, and then you're going to give the injection. You want to cleanse the patient's skin with an alcohol wipe in a circular motion like you always do. Allow the antiseptic to dry. Remember never to blow on that to dry it. You just want to let that dry on itself. You might want to fan it. Remove the cap from the needle. Then you want to grasp the syringe with the thumb and 2 fingers of your dominant hand, palm down with the needle and the bevel upwards. Hold the syringe close to the plunger end. Use a 15-degree angle. We covered the angle a second ago, so it's going to be a 15-degree angle, almost level with your arm. Slowly and steadily inject the medication by depressing the plunger with your little finger. And I know we scream aspirate, aspirate, aspirate. IDs do not get aspiration. So you are not going to aspirate with this, and you're not going to go really fast. You want to go very, very slow when you do an ID. A rapid injection can actually force, because you're so thin under that layer of skin, if you do this too rapidly, it can force the medication straight through the skin. I've never seen that done, but that's what they say in the books, that it can happen. Make sure your patient is comfortable and that they're fine where they're sitting. Observe the patient for any reactions after you've given them their TB test. Dispose of your gloves in the trash container, and then you want to lock your needle and put it in the sharps container. The needles we're using today do not have safety locks on them, so you're just going to be very, very careful and put them straight into a sharps container. Then, like I said, you're going to instruct your patient to come back in 42 to 72 hours, depending on which doctor's office you work at and how soon they want them back. Any doctor's office I've ever worked at was 48 hours that they wanted to check the results. And I have some samples on the slideshow of what reactions look like. This goes over actually what's in a TB test. This goes over everything we just talked about as far as what you're going to do, locating your site, cleaning it, checking your medication, getting it ready. You can see that the syringe is almost level there. That 15-degree angle is very, very close. And here you can see the wheel right there. So it just gives about the size of a mosquito bite is actually, and it doesn't hurt. The patient may ask you if this hurts. It does not hurt. It's almost like a little sweat bee sting. And if they're not having a reaction, it's usually gone within 30 minutes. This is more about the reactions. If they have a reaction as far as the 10 millimeter or bigger, they are considered having a reaction. If it's 5 to 9 millimeters, it's intermediate and we're not real certain. We may have to do further testing. If it's 5 millimeters or smaller, probably not having a reaction and no further testing is needed. Here's another slide that actually shows a picture. We may have to get really close up on it, but it shows a ruler, and as far as us measuring it, but you can see the flare around the wheel. That's a very good indicator that they've got a positive reaction going on there. And then you can see the wheel is still there. That's 2 days later. Here's a very positive reaction. That one, you know there's definitely something going on there. Then I've got some more samples that I want to actually show you. Let me see if I can get to those. They are right here. Let me see. I'm gonna have to go to my photos to grab those. Okay. This is actually the allergy syringes. So that's all I've got on TB test right there. I thought I had another one, but that's all I've got on those. So we're gonna actually do a TB test now. First, before we do that, we wanna make sure we've got all of our equipment that we need. You want gloves. You want to have those. You need alcohol swabs. You need those. You're gonna have to have some gauze. We didn't cover this in the directions. I'm not sure why they didn't. You don't want to put a bandage on a TB test. If it's bleeding, it's okay to blot it, but don't ever cover one up. But you want the reaction to be precise. And if you cover that up, it might press out that liquid or press it down into the tissue. You want it to just be there. So don't ever cover up a TB test. You just want it to relax there on its own. You're gonna need some syringes, the size that we gave you there. And then you're gonna need a sharps container. And then your medication, which we have. Our medication is in the fridge. So we have our medication. So you're going to always clean the top of your bottle. So even though it's been in the fridge and nobody's been touching it, you always want to clean it very, very well before you stick a needle into it to draw out the medication. So we have a patient here today who's going to let us use his arm as a sample to show you a sample of how this is done. This is not TB. This is not a PPD that we're doing. It's just a sample. We're using just sodium chloride, just saline solution, just to show you what a sample is like. So it'll go away. He's not going to have a reaction to it, but we just want to show you what a TB test would look like. And then we'll actually let you practice on each other when we get done with this. So I'm going to move the camera around so that you can see this. I'm going to wash my hands and I'll be right back. Okay, so I'm back. Hands are clean. So our patient today, I'm going to go ahead and ask him, has he ever had a positive TB test, sir?
No, I have not.
Okay, so he denies ever having a positive TB test. A lot of people have never even had a TB test. So you're not usually going to get an answer of a yes. Sometimes in my career, I've seen some patients have a yes, but very, very rarely that you'll see that. So I've already wiped that, but I did walk away from it, so I'm going to wipe it again. I'm going to draw up my 0.1. And we're going to use all of that. Okay, so this is going to be tricky. We're going to move the camera so that you can see what I'm doing here on his arm. You want to be lower than your patient when you do this so that his arm is actually held down a little bit. So you want your thumb and your four fingers wrapped around his wrist or his forearm so that you can pull the skin taut. You want that skin taut. His skin is pretty taut as it is, but you want it to be tight. That's going to help the needle to go in. You're going to clean it in that circular motion. You can fan it. Remember what I told you, students, do not blow on this. It's very unprofessional. So you can fan it just to draw that alcohol, because that alcohol, if it's on there and it's not dry, that's going to cause it to burn really bad when this needle goes in. And your patient's going to be very, very unhappy with you. So then you're going to go bevel up. I don't know if you can see that, but your bevel needs to be up. So bevel up, just barely under the skin, and just inject all of that medication. Do it very, very slowly. See that wheel is already rising. It's doing exactly what we want it to do. Okay, like I said, this is not a safety needle, so I'm going to walk straight to my sharp container. Okay, you can put your arm right here, sir, and I will be right back with you. I'm going to walk straight to my sharps container and dispose of this needle. Okay, and then I'm going to check his arm and make sure that it's okay. It's not leaking, so it's fine. He actually is free to go. He will make an appointment at the front desk to come back and have this checked in 48 hours. Some doctor's offices will have you draw a circle around where you did the TB test with a black Sharpie. That's going to depend upon what doctor's office you're working at. So if you're working at a doctor's office and that's their protocol, then that's what you're going to want to do, is draw a line around it. That's so they know when they come back in for a recheck where it was exactly. Usually there's still a little bit of a dot there so that you can check. But you know, just do what's protocol at your doctor's office. This lesson did not tell us to do that, so it's up to what protocol is at your office. Also, we're going to go ahead and cover the allergy testing now, because also that's done with your ID needles, okay? I've got some samples here. So this is an allergy test that we did in an office. I think this person had 18 different IDs done that day. So those are all different allergens: pollens, grasses, weeds, a cat, a dog, dust mite, and all of those are injected into his upper forearm. They're done towards your deltoid, right in here. They're still done intradermals at a 15-degree angle. Very, very small. It's not painful. On children, they'll usually add lidocaine to the arm to numb it. That usually takes about 30 minutes for that to numb. So while they're doing all the other allergy testing, they'll put that lidocaine on and let it numb up for the children. Adults, they usually don't numb because, like I said, an ID is not that painful. I've got another sample here. This is just some more needles that are lined up there in the tray before they go to the patient. And there's an ID sample of the patient. You can see he had trees, grasses, weeds, molds. He has another row over there of environments. And you can see there's the sharps container. So these needles actually had a safety on them. So you give the ID, you lock that safety, you put it straight in the sharps. And this is what his allergy test actually looked like. He was reactive to a tree. All of his grasses stayed positive. Now, an allergy test doesn't have to wait 48 hours to be shown positive. It's 10 minutes on these. So if that wheal is still there after 10 minutes, you're allergic. So they'll actually possibly get bigger than the wheal you made with an allergy test. So he was allergic to this. This patient was allergic to his weeds, his molds, and 1, 2, 3 of his environments: cat, dog. It looks like cockroach. Oddly enough, some people are allergic to cockroach. So that is an allergy test. And that concludes my lesson today. I hope that you have learned a lot about IDs and intradermals. If you have any questions, please see me after class, and I'll be glad to talk to you about anything you have a question on. Thank you.